Hello there. So what happens when there's no orthodontist involved in an orthodontic treatment plan? Yeah, you heard me right. It doesn't make sense, right? Well, that's what's happening. Dental aligners are a new craze in the market, and there are so many service providers who tend to bypass the orthodontist, the one who's trained for, I don't know, maybe a decade to treat and move teeth and understand the dynamics between joints and bite and the sensitive and very technique sensitive relationship between the gum and the bone and everything. And strangely, there are many service providers who tend to bypass the doctor and directly provide some kind of temporary dental treatment modalities to patients who are also not equally aware of the long-term negative consequences of such decisions, because of which there are lots and lots of people who are suffering from lots of bone damage, gum disease, and even joint issues. What do we do then? Well, here's a story of one woman who unfortunately believed the lies of aligner companies and just decided to go ahead without a in-person orthodontist planning the treatment. And here's how it went.
Where they have got a solution of transparent aligners that could be fitted on your teeth, and it can give you promising results. But after using it for about 1.5 years, for almost 2 years, I didn't get the result that I was expecting. As you can see, I still have a gap in my lower teeth left, and the alignment, you can see, is still not properly done. And overall, it has impacted my smile. I was also into a profession which involved, about my looks. I was greatly disappointed. It resulted into some narrowing of teeth. It completely disaligned my teeth, and the smile that I had was completely disrupted. Braces with the vigilance of an expert is an important part, and invisible aligners may not work for a patient. For me, it personally didn't work. And now, with this smile, as you can see, I'm really happy and glad. I think more than me, my family will be happy that it's been such a 4 years of a thing. But yeah, now, with the braces and Mr. Vaiju, it's been, I think, 10 months, and I think I'm now back on track, and I think I can happily go back home smiling. Thank you.
The purpose of this video is to create an awareness amongst everyone, both the patients as well as the line of service providers and even our dental specialists, that you need to have an orthodontist planning the case, and also the orthodontist is supposed to make the call whether a patient is apt for aligner treatment or braces treatment or myofunctional treatment or fixed functional therapy. There are many, and the orthodontist is supposed to make the final call on it. Just because we have different varieties of options does not mean that they are good for all patients, and all patients are good for those options as well. And in the backlash of so many cases, failed cases, and patients coming back with painful joints and difficult bite relationships that they can't even seem to bite and chew, we hope that this video brings about an awareness. And please, if you are having a dental issue, if you are having a bite issue, if you're not happy with the crooked or spaced out teeth that you have, please reach out to your local dentist and get in touch with a specialist, get in touch with an orthodontist, and get a proper treatment plan. Don't blindly believe the marketers who are trained to advertise what they have is the best. No, that's not what you need. You need an orthodontist. You need a good doctor who cares for your teeth, who's trained to take care of emergencies and to prevent certain bad scenarios from occurring. Take care.